Bismillahirrahmanirrahim. Assalamu alaikum. I hope you people are fine. I'm your teacher Saimat Unoli with the 18th lecture for civics, and today we are going to do chapter number 3, in which we have been doing social services in Pakistan. Open your book on page number 63. We have previously studied what social service is. Today we are going to study social services in Pakistan. Of late, social services in Pakistan have gained increasing importance with the public as well as the government. An organized effort is being made to encourage the understanding of social welfare works by the people and to instill in them a sense of responsibility and self-help. Now, the people from different fields of life voluntarily associate themselves with the social welfare and community development work. Many colleges now have introduced social welfare programs as a subject of teaching. So we can say that it is so important that this discipline should be taught at school or college level, so that people should have a comprehensive know-how about the benefits of social services and social welfare. Being a developing country, Pakistan, there is an urgent need for social welfare schemes. In Pakistan, we have a great number of needy people who require different types of services. Moreover, Pakistan is a developing nation undergoing an industrial revolution. Always a social revolution is followed by an industrial revolution. Hence, there is an immediate need to develop new social relations, attitudes, standards, and values which can properly be implemented and adjusted through the organized social welfare agencies. They provide many different types of facilities and services to the people. Social welfare services in Pakistan include such programs like health, education, housing, and social security. On the other hand, our country is confronted with many different kinds of social problems. There are many reasons of these social problems like poverty, gurbat, illiteracy, nakhwandagi, ignorance, jahalat, ill health, bad health, that is, people are not properly nourished, they are malnourished, unemployment, आपके पास job ना होना, and underemployment. So these are the various factors for which we need to have some kind of social services and some kind of social services provided to them. Due to these problems, the children and the young suffer the most. Therefore, there is a need for both government departments and private agencies as orphanages, Darul Aman, and other child welfare unit to come forth and provide them assistance. They need to organize and manage well-planned and systematic scheme of social services for welfare. So in this way, we will be able to provide some kind of we can say assistance to the people, and we will be able to eliminate these social or we can say crucial issues which we are facing as a nation. Today there are many organized social welfare agencies which are very actively and effectively playing their role to assist the needy sections of society. They serve voluntarily, रज़ाकारान ये हैं अदारे जो फ्री ऑफ कॉस्ट काम करते हैं, लोगों को हेल्प आउट करते हैं in their social or health issues or educational issues. In Pakistan, there are 4,500 voluntary registered social these social agencies and welfare agencies. Among them, the most prominent and noteworthy are Eidi Foundation, We have Red Crescent, APFA, All Pakistan Women Association and Ansar Barni Trust. Ansar Barni Trust में तो लोगों को legally assistance भी दी जाती है if they are facing any kind of legal issues. So all these foundations, they are working voluntarily and free of cost, and they are trying to help out the people, especially as Pakistan is a developing country and we are having numerous issues, especially social issues. So we need to have these social welfare organizations. Health. First of all, the most important thing, that is public health is the reflection of a community. In that it is a social utilization of scientific knowledge for medical protection, maintenance and upholding of the public health in general. That is preventing the outbreak of diseases and curing disease through organized public efforts. So this is what it is required in health area or health field, that we should be using or utilizing scientific knowledge, and we should be providing people with all kind of health cares and protection and maintenance and upholding of the public health. And at the same time outbreak of diseases, जब कभी कोई वबा फैल जाती है उसकी क्योर कैसी होगी, कैसे लोगों को ठीक किया जाएगा, तो this is the most important thing. This social service focuses that is the control of community disease, sanitation and hygiene of the environment, the organization of medical and nursing services for the diagnosis and treatment of diseases in individuals, the education of the citizens in the principles and personal hygiene and of the preventive medicines, and the development of the social machinery which will ensure to every individual a standard of living adequate for the maintenance of health. So we need to have these social service organizations which will be providing people all kind of assistance for improving their health standards, for hygiene and everything. Because if we are facing unhygienic environment, that leads to a lot of diseases and outbreak of lot of different skin and other diseases. तो बहुत ज़रूरी होता है कि सफाई रखी जाए और उसके लिए लोगों को हर तरह से गाइड किया जाए. गवर्नमेंट भी करती है थ्रू दिस TV media and everything. We have been seeing this thing in the last few months, that there is certain instructions which are given to us for oral hygiene, especially to that of hand washing and cleanliness, to be free of this corona and any other kind of viral diseases. The functions of health service are of three folds. They are of three kinds. That is, we have this maintenance of health, that is maintenance of health of the people in general. That is overall जो माशरा है उसमें लोगों की हेल्थ पे फोकस करना गवर्नमेंट की ड्यूटी है. उनको हर तरह से हेल्थ फैसिलिटीज़ प्रोवाइड करना और उनके लिए हॉस्पिटल्स होने चाहिए जहाँ पे लोग जा सकें और प्रॉपरली उनकी लुक आफ्टर हो सके. And especially for poor people, if they are not able to pay the fee, there should be free health camps for them or free health units for them where they will be provided assistance. Because आपकी जो कहते हैं कि if you have a healthy mind, you will be having a healthy body, you will be having a healthy mind. So for the future, we can say development of the nation, we need to have healthy people who will be able to work properly and with full zeal and zest. They are there to serve the nation. Then we have a second one, that is the prevention of diseases. बीमारियों को ख़त्म करना, prevention करना, that is most important if we are having any outbreak of those diseases. And third is treatment or cure of the disease in case we are having or we are facing any kind of epidemic or any kind of disease. In that case, there should be maintenance of the health कि ऐसी नौबत ही ना आए. अगर आ भी जाती है तो फिर prevention of diseases उससे कैसे बचाव करना है बीमारी से, और फिर उसकी ट्रीटमेंट एंड क्योर क्या है. These are the most important things in the health service department. In Pakistan, there exists only one doctor for a population of 1400, round about we can say 1500, 1466. So in Pakistan, health facilities mainly provided by the government. Though the private sector is increasing its participation in the field, most of the facilities are concentrated in the urban areas. Mostly आपके city areas में, दही इलाकों में आपको फ़ायदा हो जाता है, और दही नहीं, आपके सॉरी शहरी इलाकों में लोगों को फ़ायदा है. दही इलाकों में, गाँव में, कस्बों में, in rural areas and urban villages, we hardly have these facilities. As we can see that in Pakistan there exists only one doctor for a population of 1466, one dentist for 29,405 people, one nurse for 3,347, and one hospital for 1517 people. That is, people, the serving people, the doctors and the paramedical staff is very low, and if they are there to serve in rural areas, they are reluctant. अब शहरों से गांव की तरफ कोई जाना ही नहीं चाहता, और वहाँ पे गवर्नमेंट हॉस्पिटल्स में हमारे पास ना कभी गवर्नमेंट के डॉक्टर्स अवेलेबल होते हैं, ना ही पैरामेडिकल स्टाफ होता है. सो दिस इज़ अ वेरी ड्रास्टिक सिचुएशन. There are about we can say 10,1,635 registered doctors. That is, we have 1,1,635 doctors, and we have 5,068 dentists and 44,520 nurses in the country. Still we need to have more people. The health of the people is a matter of great importance. It occupies a very significant place in the economic and social development of a country, क्योंकि आपके पास सेहतमंद लोग होंगे तो वो काम कर सकेंगे. In Pakistan too, it is both a personal and national issue. Many problems of health and hygiene beset our country and countrymen. For instance, many diseases and ill health are common and widespread among our people. Epidemics are frequent. Life expectancy level is low in the country. It is 62 years now. Previously it was 45. Child mortality is very high, and half of the babies die within first year after birth. So जो बच्चों को ज़च्चा और बच्चा को जो एक निगहदाश्त और प्रोटेक्शन की ज़रूरत है, that is not properly available. Then we have the kinds of hospitals. Hospitals की kinds कितनी हैं हमारे पास? We have the general hospital, or we have different kinds. That is, they are those hospitals, general hospitals, where all kinds of diseases are treated. They are the oldest and the most common type of hospitals, and are found in all cities and towns in our country. They are generally established by the government, but some of them are working under private organizations and individuals. The examples of government general hospitals are Mayo Hospital and General Hospital in Lahore, Lady Reading Hospital in Peshawar, Jinnah Hospital in Karachi, Polyclinic and Pakistan Institute of Medical Sciences, जिसको PIMS कहते हैं, that is in capital Islamabad. Besides these hospitals, there are various civil hospitals in such towns which are at distinct headquarters. Mission Hospital and Muhammadai Hospital in Peshawar, the Holy Family Hospital in Rawalpindi, and the United Christian Hospital in Lahore are examples of privately established general hospitals in the country. These are very famous names of these hospitals. We mostly hear them on TV. Then we have military hospitals. Military hospitals are found in the cantonments for armed forces. They are combined military hospitals, जिनका जो abbreviation बनता है CMH, which treat the officers and soldiers of all the three armed forces. These CMH, combined military hospitals, mostly are dealing with the army personals. Then we have the railway hospitals. They are set up by Pakistan Railways for the treatment and medical care of the railway employees, अपने लोगों के लिए especially. Then we have the psychiatric hospital. These are hospitals for the care and treatment of the mental illnesses. In these hospitals, the mental patients are treated by modern techniques and methods. In Pakistan, there are very few psychiatric hospitals. Best known psychiatric hospitals are located at Lahore, Hyderabad and Karachi. Lahore का जो है उसको तो फाउंटेन हाउस कहते हैं, and that is located near Mall, और ये बहुत अच्छा हॉस्पिटल है. Then we have sanatoriums, these and the TB hospitals जो tuberculosis को डील करते हैं. These hospitals treat a person suffering from tuberculosis. TB इसका abbreviation है, a very fatal and deadly disease which can be cured only with special medical treatment under expert care. Unfortunately, TB is a very widespread disease in our country. Around 1.6 million people are suffering from tuberculosis. Simli near Murree, Dawar near Abbottabad and Jamshoro near Hyderabad are some well-known and renowned hospitals for the treatment of patients suffering from TB. Then we have the maternity hospitals. Maternity hospitals are meant for the care and attention of pregnant women at the time of childbirth and a few days thereafter, as well as for the care of the newly born babies. There are nutritional problems also, such as anemic, खून की कमी होना, and goitis, वो जो एक गले में एक बड़ा सा lump आ जाता है. Sometimes such hospitals are attached to the mother and the child centers, so they are able to deal properly. ये आपके maternity hospitals हैं जहाँ पे बच्चों को फौरी निगहदाश्त दी जाती है पैदाइश के बाद. Then we have drug abusers hospitals जिसमें rehabilitation center है. These are hospitals for the cure and treatment of the people who are habitual, आदी होते हैं of taking injurious drugs, नशा करने के आदी हो जाते हैं, और कभी तो उनको लगा दिया जाता है या फिर वो intentionally ये mistake कर जाते हैं of taking these intoxicated drugs, and with time it becomes very lethal for them, fatal हो जाता है और जिनकी लाइफ को और हेल्थ को इफ़ेक्ट करता है. तो उनको ऐसे बच्चों को जो को कहीं भी हो, they should be immediately sent to these rehabilitation centers and they come out of it healthy if they have a strong willpower. Otherwise they become a liability and a burden for the family. So we have other kinds of hospitals also, there are also various other kinds of hospital. Eye hospital are established for the treatment of eye diseases, for the treatment and care of teeth. Dental hospitals are set up in the country. There are free hospitals for the treatment of the poor and the needy. Besides all these hospitals, there are also clinics, nursing homes, sanatoria and such other institutions for the special treatment and cure of the patients. So with this you can understand the different kinds of hospitals that we are having in Pakistan and even in every part of the world. This is all for today. Learn these hospital names, where they are located, and I will be sending you the test on the portal. Please attempt that test and send me its WhatsApp images. Thank you. Thought for the day is, no religion is higher than humanity, and this is said by Abdul Sattar Idi. Thank you and stay blessed.